Lower back pain in the younger athlete is often brushed off as just normal growing pain. However, when I see younger athletes who are very athletic come in, anywhere from, say, the ages of 13 up to 18, we have to acknowledge one of the most common conditions is a stress fracture. And what we know about the younger athletes is that their bones are still developing and are really soft. In an adult, if we have an adult who comes in with lower back pain, it's usually the disc that becomes degenerative. These are the discs in between the vertebrae. But in the younger athlete, it's quite common. And what I've done here is I've drawn a line through areas where a stress fracture can start to occur. And literally this part, the PARS interarticularis, which is the part that's in the blue here, you get a stress fracture that can form here because the bones are quite soft. And these kids are doing a lot of activities, especially extension activities. So in fast bowlers, in divers who go into an extended position, pitchers, even rugby players who are going through and doing a lot of running and kicking, we've seen these PARS defects or interarticularis defects start to become prevalent. And I'd have to say, if I have an athlete who comes in who's anywhere between the age of 13 through to 18 and they've got lower back pain that's lasted for more than 2 or 3 weeks, I send them straight for an MRI. In almost 50% of cases, these patients come back and they actually have a stress fracture. And what's really important is that we need to identify this early so that we can then put an intervention strategy into place. Time and time again, I'll see these kids who have had 3 months of physio, tried to go back to sport, it hasn't worked. And so what we need to do is early MRI investigation. This is one time I really do think it's important that we MRI them because, as I said, some of the studies indicate between up to almost 40 to 50% of these come back with these stress reactions. And what happens is you get a bony edema that occurs, so swelling in the bone, and they can form a stress fracture. And the last thing is we want is a stress fracture in the spine in a younger athlete. It can be catastrophic later on. The stress fracture you can actually get a breaking of the bone. And then what happens is that the spine becomes unstable, and this develops into what we call, it's a very long word, a spondylolisthesis. And there's actually a shifting of the spine. And unfortunately, this can become catastrophic and also cause a lot of problems down the track. So firstly, take-home message, early identification. And this is where, in fact, interesting, plain x-rays are not that effective. We find the MRI is the gold standard for these. So an MRI early. Number 2, often these athletes, they're very painful in extension. So we get them to try and extend. They'll say, oh, I can feel pain in my lower back on extension. So we need to identify them early. Secondly, once we've identified they do have a bone stress reaction, we then need to go through and start them. We need to stay away from the activities. Unfortunately, running, jumping, any sort of loading activities like that need to stop. And this is the tough bit, for 6 months. And again, if I was to go onto the internet and you try and do searches on this or talk to very learned people, there's a huge spectrum of advice. I guess after being a physio for 30 years and seeing literally tens of thousands of patients, I've learnt the hard way that trying to fast track their recovery often ends in disaster. And I'll cut straight to the chase. PARS defects in certainly from my treatment course, they need to have a minimum of 6 months off their activity, 6 months without jumping, loading. They need to then, when they go back to activity, so let's say they were a cricketer, they're going to go back at 6 months in a modified way. So they're not going to go back bowling, 6 overs or 8 overs in a cricket session. They're not going to go back into a rugby match and play the whole rugby match, but they're going to go back at a 50% level, probably up to 12 months for another 6 months up to the 12-month mark. In that first 6 months, they're going to go through and do core stability program, physiotherapy to keep the hips loose to the thoracic spine, and then stabilization through here. And the hardest part initially, and this is the tough love part, we need to actually counsel the parents and the kid to actually explain that it's going to be a 12-month recovery. Yeah, 12-month recovery, tough. 6 months, as we said, low load activities. Unfortunately, they can't play in the playgrounds, running and jumping. They're going to have to go through and be compliant with the strengthening. And then we need to slowly get them back into sport. So normally at around about the 5 months of their rehab, we'll start them on a bit of pre-jumping, into running and full jumping. So I think in summary, with children, again, anywhere from the ages, especially 12, 13, up to 18, who are getting lower back pain, be highly suspicious of a PARS interarticularis defect and a stress fracture in the lower back. And really, the identification early with an MRI is so important, not just a plain X-ray. Secondly, be prepared that it's going to be a long treatment course, up to 12 months, 6 months off the activity, and then a 50% return to activity that they're doing for that final 6 months. I guess in summary, see very experienced physiotherapists or surgeons or sports physicians that will give you a definitive diagnosis early, rather than this sort of guessing game, because the kid's back is too important. And I've got patients who ignored this early, produced PARS defects, pushed on through sport, and they got stress fractures that then became unstable, and they went through and had fusions. Like, we don't want that for a young teenager. Thanks very much, and happy exercising.